Some counselors are uncomfortable with diagnosing through the DSM-5 system because it is based on a medical model and pathology, where counseling is based on a wellness model. However, counselors should learn to diagnose clinical disorders for a few reasons. One major reason is many insurance companies will not pay without a diagnosis, which brings up a few ethical concerns that I will discuss later. While there could be negative effects on labeling somebody with clinical disorders, at times it can be beneficial. When a counselor better understands their client's needs, they can provide better interventions. Counselors being able to diagnose clinical disorders also enables counselors to collaborate with other mental health professionals while looking out for their clients' well-being. When a client understands a diagnosis, sometimes it can give that client hope and answers. This is not always the case. As Rimley and Hurley 2020 pointed out, diagnosis can lead to self-fulfilling prophecies, becoming worse off than before. Nevertheless, diagnosis can open up opportunities for resources and let clients know that they are not alone in their experience. When counselors diagnose clients with a pathology, they must be careful to follow all ethical guidelines and be well trained and qualified in those tests. Some of these guidelines are discussing the test with the clients prior, being careful when releasing information to third parties. Counselors must also be aware of cultural bias within the test and evaluations, and remember culture diversity when performing the assessments. Counselors are recommended not to use a test alone, but many evaluations. One major ethical issue that has arisen in counseling is diagnosing inaccurately for insurance purposes. They may feel like they're promoting the client's well-being, but it is unethical. It is essential that if we are going to diagnose clients, that we accurately diagnose. According to Rimley and Hurley 2020, counselors are both legally and ethically expected to only administer and interpret tests that they have been trained and qualified to do so. After tests are completed, counselors need to communicate the test results with clients and educate them on the limits of the test.